Great. Thanks. We're very pleased to have with us several guests from UN Women. In the center is the Executive Director of UN Women, Phumzile Mlambo-Ngcuka. To her left, you have Ginette Azcona, who is a Research and Data Specialist. And to her right, you have Shahra Razavi, the Chief of the Research and Data Section and lead author of the report, Gender Equality in the 2038 Agenda for Sustainable Development. Ms. Mlambo-Ngcuka, the floor is yours.
Thank you very much. Today we are proud to launch our new report entitled Turning Promises into Action. You better show it. Into action. This report gives us the most comprehensive assessment to date of where we stand on gender equality across all 17 Sustainable Development Goals. The global community, as we all know, committed to achieve SDGs by 2030. And we also know that gender equality is both an important goal in itself and a catalyst for achieving the entire 2030 agenda and a sustainable future for all. That is why it is very important for us that all the goals address gender equality to some extent. But you will find that in terms of the way the indicators are, Goal 1 on poverty, Goal 3 on health, Goal 4 on education, Goal 8 on decent work and economic growth, 16 on peace and security, and 5, of course, on gender equality, is where the substantive issues that address gender equality are addressed. In the other goals, there is an effort to address gender equality. We, for instance, would have loved to see more on women in Goal 6 on sanitation and water, and on Goal 7 on energy. So if all the goals, both in implementation and in the manner in which the indicators are, had even greater robustness in dealing with gender equality, we truly would see 2030 achieving what it is meant to achieve. So in our reports, we are tracking how we are doing with what we have, which is quite substantive. The report reveals that in many areas, progress remains slow to achieve the SDGs by 2030. Even where progress is made, it may not reach the women and girls who need it most, and the ones that are being left furthest behind. Critically, the report also gives us recommendations, so there's something we can do about the situation. One of the striking examples from the report is that it illustrates the point of how far behind in eradicating maternal mortality in both developed and developing countries, when we already have the technology and expertise to make birth safe and to ensure that women and their babies receive the necessary medical care and follow-up. More than 300,000 women should not still be dying. That is 300,000 a year, should not still be dying from pregnancy-related causes. If we are to achieve the global targets in this area by 2030, we definitely need to triple the current rate of change. Development, it shows in the report, is not necessarily a guarantee for progress. For instance, rates of poverty for single mother households are high in many countries, including, for example, countries such as US, Luxembourg, Spain, and of course, as well as South Africa, my own country, and Brazil. We need to ensure that the health of women and their babies are given utmost priority, that women's pain is taken seriously and not dismissed, and that women are believed when they raise issues. We get much better at reaching poorer women and women in rural areas where we have women working in those communities and a strong women's movement. And we need to end harmful practices that contribute to high death rates in teenagers. Other case studies and data sets from the reports take an in-depth look at the situation of 5 countries: Colombia, Nigeria, Pakistan, South Africa, and Uruguay. For instance, women in the poorest households in Nigeria are 3.6 times likely to be married as children as women from the richest household. In Pakistan, almost half of all women and girls aged between 15 and 49 have no say in decisions regarding their own health care. In Colombia, the poorest rural indigenous women are more than 300 times likely to lack skilled delivery care as women in the richest urban majority group. This report also has key findings that I will just mention, that we need to integrate integrated approaches that put gender equality at the center of SDGs implementation and harness interlinkages. We need to close the financing gap. In almost all countries, there is gross underfunding of the women's agenda. As I say, sometimes the women's agenda is broke. Also, we need the strengthening of gender statistics in all countries, and the countries whose monitoring is needed most tend to be the ones that struggle most to have adequate statistical services. And of course, we also need to ensure that those in power are held accountable. So Shahra, who is one of the lead researchers, will give you some of the concrete examples and highlights of the reports. Thank you.
So should I just proceed?
Oh, yes.
Yes. Okay, so thank you very much, Edie. I'm going to just add a little bit more detail on some of the points that the Executive Director has already raised. First, to begin just by saying that this report is actually the first of its kind. It's the first report coming out of the UN system 2 years into the new agenda that looks at the entire agenda from a gender equality perspective. We provide a very detailed account of the status of women and girls under SDG 5, which is the dedicated goal on gender equality. But we also look at gender equality and how it plays out on all the other 16 goals of the agenda. To just give you a few examples of some of the interesting sort of findings and new data points that come out of this analysis. On poverty, UN Women partnered with the World Bank to produce a gendered analysis of poverty rates. And I'm very pleased to say that after many years of hearing many guesstimates of, 70% of the world's poor are women, we actually in this report provide data for 89 developing countries that together cover 84% of the population of the developing world to show that, first, women are 4% more likely to live in extreme poverty than men. And secondly, once you disaggregate, what you will see is that the poverty is the gender gaps are particularly large in the 25 to 34-year-old age group, which is when something like for every 100 men who are living in extreme poverty, 122 women are living in extreme poverty. And these are, of course, the peak productive years when a lot of men and women are working to support their families, but also this is the peak reproductive period when a lot of men and women have young children to support. And what this gender gap, widening of gender gap in this particular age group shows is the difficulty that women in particular have in reconciling production and reproduction. And the policy implications are also very clear in terms of the need for greater redistribution of care work between women and men, but also the much greater need for public support in the form of childcare services that are accessible and affordable, and in the form of paid maternity and family leaves. Another area on food insecurity, again, we're drawing on data from 141 countries to show that women are more likely than men to be food insecure in nearly 2/3 of countries for which there is data. And this includes both developed and developing countries, including the UK, for example, as well as countries like Peru and Pakistan, where the gender gap is at its highest, 11 percentage point difference between women and men. We draw on the available data to also put a spotlight on violence against women, which is one of the key targets under Goal 5, to show that global globally 19%, or 1 in 5 women, have experienced physical and or sexual violence by an intimate partner over the past 12 months. And we show the regional differences in the prevalence of poverty. And we also throw a spotlight on the kind of measures that governments are taking in the form of legislation, service provisioning, and prevention measures to address this global pandemic that affects all countries. To give you another example from one of the environmental goals, Goal 15, we show that between 2010 and 2015, the world lost 3.3 million hectares of forest areas, and this is something that particularly takes a toll on poorer women, particularly those from rural areas, who are from landless households or near landless households, who rely on forests for many of the items that they need for day-to-day subsistence, whether it's in the form of firewood or food items. And it's particularly worrying in a context where a lot of large-scale investments are displacing women and men from these areas. We also throw a spotlight in Chapter 4 on 4 particular countries, looking at the whole central principle of the agenda, which is leave no one behind, by showing the way in which women who live in the same city or the same country can be living worlds apart. Here we look at Colombia, Nigeria, Pakistan, and United States, and we show the way in which averages can mask inequalities among social groups, which does a lot of injustice to those who are at the bottom of the social scale and hides the privileges at the top. And we show the huge inequalities between different groups of women in these countries in different aspects of the SDG agenda. In the interest of time, I won't go into any detail on this, but I want to sort of make the point that the Executive Director has already said, that in addition to taking a look at where we're at in terms of what the data shows on progress on gender equality under the different goals, this report is also very forward-looking. And we argue that 3 key elements are needed in order to monitor and accelerate change for women and girls: better data, much stronger accountability mechanisms, and transformative policies. On data, let me just give you one indication of the kind of struggles that we have with data on gender inequality. Even though in this report we really try to squeeze all the available sources to get the most up-to-date data on all the different areas that need to be monitored, it's important to point out that only 24% of the data that we need to monitor the gender-specific indicators we have is recent data, that is from 2010 onwards. For only almost a quarter of the gender-specific indicators. So that's just one indication of the struggle that one has with data gaps. On accountability, we make a strong plea for stronger participation and accountability, and for making the mechanisms that exist at national level, regional level, and the global level, including the high-level political forum, a stronger space for civil society participation and for really trying to bring good discussions between policymakers and those who are demanding greater equality, and bringing women's civil society organizations into these spaces. For the HLPF in particular, we hope that it can become a stronger platform for accountability, with more time allocated for voluntary national reporting, for peer reviews, and also for civil society participation. And on the third element, transformative policies, we emphasize that essential services on which millions of women and girls depend, be it health, water and sanitation, shelters, these are services that are chronically underfunded or simply just unavailable in too many countries. And when there is austerity measures, these are the services that are the first to get the axe. So that's a real concern that we have, which really goes against the spirit of the agenda. And in virtually all countries, there is scope for reallocating or raising new resources to avoid these cutbacks and to instead really try and strengthen these services. What we also show with the example of early childhood education and care, with data for 2 countries, South Africa and Uruguay, is that this is a measure that is actually possible to do. We show that by providing free early childhood education and care for children 0 to 5 years old. You can not only meet a number of goals in terms of children's development, in terms of children's health, education, making them prepared for schooling, for learning, but also reducing the amount of unpaid work that women carry. And at the same time, this is also a kind of investment that can meet the decent work agenda by providing and becoming an engine for employment generation, because these services need people to run them, and this is a very good way of generating employment. And the data for South Africa shows that providing 0 to 5 universal free services for children would have a cost of 3.2% of GDP annually, which is not a small figure, but the returns are also very high. The expansion would create 2 to 3 million new jobs, which in South Africa would increase women's labor force participation by a little over 10 percentage points. So this is quite significant. And something like around 38% of the initial fiscal expenditure can also be clawed back through the social security revenue and taxes that the new jobs would generate. So it is a very good example of a policy that addresses gender equality but also meets many of the other goals on the agenda. Just to end, I'll say the report does provide a reality check showing that much remains to be done, but also a roadmap in terms of how to move forward through dramatic advances in statistics, in policies, in finances, and in strengthening of accountability. We hope that it'll be a useful resource in the hands of all policy actors, policy makers, policy shapers, journalists, and the greater public. Thank you very much.
Not all bad news from South Africa.
Okay, thank you. So we will now open up the floor for questions. Please indicate to whom you're asking those questions. Sherwin.
On behalf of the UN Correspondents Association, thank you to the panel for this briefing. I'm Sherwin Bryce-P, South African Broadcasting. It's a related question to the report. How does the Me Too movement inform what you seek to achieve through the data you share with us in this report? And what, Madam Executive Director, did you make of President Trump's remarks recently that mere allegations by women of abuse is ruining people's careers without due process being followed? Thank you.
Well, we would have done this report even without Me Too. In fact, the work began before the movement is visible to everyone. But it's been an important enabler because it takes us a lot of time to collect data when we're doing research. But with a movement like that, instantly, there's a lot of data out there in front of everybody. Everyone can see how prevalent sexual harassment is. We can see that one executive can be a serial offender without any consequences, and how long it takes women to come to terms with the situation and gain the courage to come forward, something that we have to monitor over a much long period of time. So that has been quite helpful. But also the fact that there has been consequences and there has been a call for accountability in real time has helped us to make with greater agency the fact that this has to end now. So certainly it's been a great enabler. And of course, people who actually do not believe women, especially if they are policymakers, contribute towards an environment that takes away the possibility for more women to actually come out. And that is why it is important for the public, for society, for the media to call them out so that there will be louder voices that believe and support women. We also support due process, no doubt about that. But, most women will not put themselves into that situation if they don't have a real story to tell. Thanks.
Thank you very much, Evelyn Leopold. I haven't obviously read the full report, but when you mentioned maternal mortality and health, do you have anything in there on sex education, or is that still pretty taboo in the GA? It seems to me that children having children need to know the dangers of it and what a contraceptive is and so forth.
In the report, we do have data on legislation in countries on sexual and reproductive rights, and we do have a discussion on the need for not only having the right kind of health services, but also information on sexuality education and its importance in terms of informing young women and men. So there is some mention of it in the report.
Contraceptives mentioned, or is that a no-no?
We do have it mentioned. Do you want to follow up on that? Yeah.
Just very quickly to say that, of course, that's one of the targets under Goal 5, is Target 5.6. And what we've done, which, as Shahra mentioned, is something that is not done in any of the other reports out there looking at the SDGs, is to look at every single SDG from a gender perspective. And for Goal 5, we actually go at the target level. So for each of the targets, we have something to say, and that is definitely something where we talk about some of the issues in terms of data as well, where we want to have much more data to be able to say something more concretely about some of these issues.
Yes, it's a follow-up from the first question, and it's about the relation of your organization with the media, how it can stay, the message can go through, especially in situations like this, when we have a situation when we see a very important leader in the world, in the White House, not responding like the public opinion will expect. So my question is, how you can do, I understand that we are here and there is diplomatic concern, you cannot say what you may be thinking all the time, but how you can make women in this country, all over the world, to know that there is at the UN a woman that at one point will say how things have to be said. Anyway, my name is Stefano Vaccara, Radio Radicale, La Voce di New York.
Well, I think for one, it's I have to give some credibility to the media in the US about the way in which they have covered the women that have come out. But we also know that this is a tip of an iceberg. We actually need more stories like that to be told everywhere in the world. UN Women is one of the voices. We're not the only one, but we definitely are one of the voices. We'd love, not that we love the subject because it's a painful one, but we love to have opportunities to highlight the situation that women face in different parts of the world. So regular contacts with people like yourself and profiling the stories of women is extremely important to us, especially writing about those countries where women find it difficult to speak for themselves. They depend on people like us and you to actually tell their stories. So we would love to be able to give the stories of women in different parts of the world, especially in the most difficult parts of the world, where they are in no position to speak for themselves.
Matthew Lee, Inner City Press, on behalf of the Free UN Coalition for Access. Thanks a lot for it. I'm going to read over the report as well, but I wanted to ask you, given this question on Me Too, about the UN system itself and whether UN Women, for example, there's a very high-profile case where a claimant from UNAIDS wrote, they say, to the Secretary General saying they were being treated unfairly, that basically offered an apology to drop their complaint. So they wrote to the Secretary General. We don't get a straight answer on what the response was, but I wanted to know, what is your role in ensuring that the UN itself lives up to the standards of a fair hearing for complainants, and not covering up as the complainant in that case feels. And I have a separate question, but I wanted to ask you since you're here, and it doesn't. I mean it with all due respect. I've seen you quoted about understandably, the current news out of South Africa, and that's all to the good. But at the same time, I don't know. I see conflicting statements by the UN in terms of what international civil servants. How do you keep your roles separate? I guess I'd ask, and I say it because it's come up with the Deputy Secretary General, some other officials, peacekeeping. Sort of, what's the do you say I'm stepping out of my UN role to comment on things in the ANC? How does it work? Thanks.
I don't think there's a playbook for that one. On the issue of the UN and how we are handling these allegations, we have decided with the Secretary General that we actually need to convene a meeting of heads of agencies in the UN, in particular also what you'd like to call UN men, to dive deep into every agency, previous, current, and potential cases that exist, so that we can actually see the pattern of how we deal with these complaints, where we have failed, but also the capacity, because the UN does provide a lot of remedies, but we don't always have the capacity to deal with all the cases at the pace that many of the victims and survivors will respond. So that puts us on a back foot when it drags and the complainant is waiting, and sometimes if you have then to take it to the police, it means that the investigation starts again. So we've identified those as some of the areas that we're going to improve, and we have in the sidelines of the CSW, we intend to convene with the colleagues so that we can actually look at our system and at the same time also enforce the 5-point plan that the SG recently announced, in addition to what is already available in the UN system. I have to say, I'll be first one to say that we actually have a lot of room to improve ourselves, especially not so much in the policies that we have, but in practicing and implementing the policies that we have.
When is the meeting? Just one.
I think we're trying to get but it's going to be in the month of March. Yeah.
Thanks a lot.
Joseph Klein, Canada Free Press, and this question is for the Executive Director, but if anyone else on the panel wants to comment, that's fine. The 10th item on the 12 takeaways is violence against women and girls. And you say, quote, laws against violence must be enacted and strictly enforced. I wonder if you can comment on female genital mutilation and whether you had focused on that at all in compiling your report, and whether you believe that that should be a subject for legislation against violence. Thank you.
You want to take that one?
Yeah, I can just quickly say, and I think Shahra will probably jump in, is to say that of course we do. We actually have a spotlight on female genital mutilation in the report. The headline there is, if trends continue, rate of FGM will increase over the next 15 years. We estimate that at least 200 women and girls in 30 countries have undergone FGM. It's a challenge still, something that is a target in the SDGs, something that we want to see eradicated over the next, 15 years, and we still have a long way to go. And in our policy chapter, we then go into very specific policy recommendations for how to tackle that.
Could you elaborate a little bit on that? Because, for example, in the United States, there are several state legislatures that are grappling with bills that have been submitted against female genital mutilation, but it's running up against objections by some that this is culturally insensitive, and so forth. So have you recommended, and I guess I'd like to hear from the Executive Director on this particularly, have you recommended that there be specific legislation addressing this issue?
You mean in the U.S. specifically, or
No,
generally?
no. Now I'm just giving you that as an example. It's a subject in the U.S.
Yeah, we do recommend. She'll give you the specific, but we do recommend. Yeah.
Yeah, in the chapter, in the policy chapter on violence against women, we look at FGM, and there on the question of legislation and other kinds of actions needed, we emphasize the importance of legislation, but also that legislation on its own is not enough, and that especially because of the kind of argument that is sometimes presented that this is an important part of a culture, it's really important to work with communities to try and change the discourses and the thinking around how important an element like this is to any one culture. And we give the example of a program in Senegal that has been very important in working with communities, with leaders of communities, to try and change the social norms around the acceptability of FGM, and that this particular program has, by all accounts and evaluations, had very positive outcomes in terms of reducing the prevalence of this practice.
If I could also add that in order to continue to highlight this harmful practice, we recently announced a goodwill ambassador from the Gambia, who's a young woman who has experienced FGM herself and was a child bride, but is a strong survivor, has now lives in the US, has a foundation which is fighting these two practices, went to engage President Obama when he was in office and facilitated a law to be a federal law to be passed in the US against FGM, and she continues to work in Africa. And she is now a nominee for a Nobel Peace Prize, which we hope many of you will write about, so that she has a chance of winning, because we think that will really help to give profile to the issue, because he is a young woman, grassroots, who has just fought all her life to save other girls so that what happens to her doesn't happen to other girls. So we're trying different ways to keep the issue in front of policymakers.
Yeah, thank you. My name is Masood Haider. I represent Daily Dawn newspaper of Pakistan. I just want to about this gender inequality in Pakistan that you have highlighted in your thing. Just want to know, what is it that you believe that Pakistan government should do to what you call, that you're not already said that the whole world should be doing? Why is it specifically Pakistan that is being said, and what is it that can be done to improve it? Because I know, absolutely, women do need a push forward to be equal to men, and that's absolutely essential. Why are you singling out Pakistan in this, that it should take steps towards that? Yeah.
Let me just explain. We had 4 countries selected for in-depth analysis in seeing how different groups of women are very differently disadvantaged in particular national contexts, to look at this leave no one behind a principle of the agenda. And the 4 countries that were selected, Pakistan is one of them. The criteria for selection actually was countries that have data that is recent, that have data that's sufficiently disaggregated with large enough sample sizes to allow analysis, to make sure that we had regional diversity, and also that we had data on different dimensions of the agenda. So in a way, the choice of countries was a reflection of countries that have really good data, which for us is a bonus point. So countries that were selected, the 4 countries, Nigeria, Pakistan, Colombia, and USA, they all shine in terms of availability of data, which for a report that is on data is a very positive feature. And I think, we don't provide league tables where we compare countries, who is doing better than whom. But this particular very in-depth analysis showed that there are very significant inequalities in Pakistan among different groups of women, in the same way that there are in the other 3 countries. And this was really more illustrative of the inequalities that divide women within specific countries. And the problems are very pervasive. It's not just limited to Pakistan.
This is only your observation. Have you had any dialogue with the government of Pakistan or the women activist groups in Pakistan that have provided you with this data?
I hope that this report will be the basis for having discussions with Pakistani researchers, activists, government policy makers. So we look forward to that, to our launch of the report in the region and to those discussions. We hope this will be the basis for that kind of discussion.
And we do have a very active office in Pakistan.
Thank you. Ibis Frade from Prensa Latina News Agency. Could you please give me some more details about the situation of the gender equality in Latin America, please?
Say something about Colombia, or should I give something more broadly? The Europe.
Figures, the Latin American.
Why don't you take on the...
Sorry, and I actually have my mic open. Just to say that one of the things that Shahra highlighted in her presentation that's quite new in the report that you won't see anywhere else is the poverty figures. And what we find is that in Latin America and the Caribbean, that gap that she mentioned in prime working age, prime reproductive age, that gap between men and women is highest in Latin America and the Caribbean. So when she mentioned that globally 22 more women live on less than $1.90 a day globally, that number for Latin America is 32. So 32 more women live on less than $1.90 a day for every 100 men in Latin America. So that's a number that we have that's quite new in the report. And we actually see that that is indicative of the gender gap across countries in the region. The other, yeah. Let Shahra jump in.
Add one more point to that. The other way in which Latin America stands out when you look under Goal 8 at employment and labor force participation, it is the region that has had the highest increase in developing region in terms of female labor force participation over the past 10, 20 years that we have data for in the report. So it does point to some very positive things happening in the region as well. And on education, on secondary education, girls have really closed and gone beyond closing the gender gap. And we have a case study also in the report on Uruguay, again on the provision of early childhood education and care, which provides estimates in terms of the gains that can be had in terms of female employment and the kind of costing of that kind of service for Uruguay, which is already one of the lead countries in the region in terms of service provisioning for early childhood education and care.
Okay, one more.
Yes, just clarification. On FGM, did you say 200 women in 30 countries? That doesn't sound right, yeah.
So 200 million.
Oh,
Apologize for that.
right.
But I'll give you,
Okay.
just so that you have that. At least 200 million women and girls in 30 countries have undergone FGM. The data points to some improvements, most notably in Liberia, Kenya, and Ethiopia, where the prevalence of FGM among women aged 20 to 24 is 20 percentage points lower than women of an older cohort, 45 to 49. So the way we looked at trends there is by comparing younger women to older women and seeing if the practice is lessening among younger women. And we're finding that that is the case in some countries, but in other countries, FGM is still very, very pervasive. Some of the countries with the highest rates are Guinea, Mali, Sierra Leone, Somalia, and Sudan, where 85% or greater of women aged 20 to 24 are still victims of that practice.
And I'd like Phumzile Mlambo-Ngcuka, Shahra Razavi, and Ginette Azcona from UN Women. Thanks very much. Have a good afternoon, everyone.